When you first get diagnosed with CSR, most doctors tell you the same thing. Wait it out. Rest. Reduce stress. Let the fluid reabsorb on its own. And in many cases, that works. But what if it doesn't? What if the blur or distortion sticks around for months? That's when doctors sometimes bring up a treatment option called Eylea Injections. So what are they and who are they really for? Eylea is a medication originally designed for eye conditions like macular degeneration and diabetic retinopathy. It works by blocking something called VEGF, vascular endothelial growth factor. That's a protein that makes abnormal blood vessels grow and leak in the back of the eye. In CSR, the fluid comes from a different mechanism: stress and hormone-driven changes in the choroid. But in stubborn cases, especially chronic CSR, Eylea may still help reduce leakage and speed up fluid absorption. Here's the reality. Eylea injections aren't the first-line treatment for CSR. They're usually reserved for people who have chronic CSR that hasn't improved after 3 to 6 months, significant fluid that threatens long-term damage to the retina. Cases where other options, like laser therapy or just waiting, haven't worked. What to expect if you go down this road? Eylea is delivered as an injection directly into the eye. That sounds brutal, but it's done under local anesthesia, and most people describe it as pressure, not pain. You may need more than one injection, spaced weeks apart depending on how your eye responds. Now here's the part you don't always hear. Results can vary. Some patients see fast improvement in fluid absorption. Others see little to no difference. And Eylea isn't risk-free. Side effects can include temporary irritation, floaters, infection, or in rare cases, retinal damage. So who is it really for? Not the average first-time CSR patient, but if you've been stuck with chronic or recurrent CSR, if your vision is slipping, and the standard wait-and-see approach isn't working, that's when you and your retina specialist may consider Eylea. The bottom line? Eylea is not a magic bullet. It's a tool, one of several in the CSR treatment playbook. For some, it can mean the difference between ongoing damage and stabilization. For others, it may not move the needle at all. Want to know more about the other treatment options I explored? Subscribe and check out the next video. Can CSR cause scarring? What happens if fluid stays too long? Your vision is worth protecting. And the more you understand your options, the better choices you can make.